yeah, radiology is the topic of this afternoon. I get a lot of queries about radiology, how it all works, how to apply. Shaitanji has joined us. Fantastic. Thank you so much, Shaitanji. How are you?
Hi, I'm good, Aman. How are you?
Good. Excellent. Excellent. Firstly, thank you so much for taking some time out on a Saturday to do this. You do a lot of amazing work for IMG doctors, and particularly for radiology, but lots of other things as well. And it's great to get your expertise on board, because I was just saying to the guys on the live that I get a lot of queries about radiology and what it's all about and what a career is like in the UK and how to apply and all the kind of common queries that I'm sure you get as well. So I think no one better at really than you to try and come and shed a bit of light on this. So thanks for joining us. And how's your day so far?
It's been okay. Just been doing some shopping. I'm going to India soon, so.
Oh, very good. Very good. Excellent. It's a good time to go to Diwali and stuff coming up, I guess.
Yeah.
Yeah, fantastic. No, but thank you so much. And for those of you who don't know, there's lots of you on the live who will know Shaitanju already, but Shaitanju is a radiology trainee in the East Midlands. He came to the UK in 2019. If I'm not mistaken, Shaitanju, is that right? Around 2019. Yeah, and is making a name for himself as somebody who helps out a lot of other doctors, you know, in various fields, like I said, and he's got some great content on social media. And, you know, I know that a lot of you guys watching today will know Shaitanju already and have benefited from some of his amazing videos and lives and webinars and things that we did. And we were lucky to get you on our last IMG Careers Conference, and you did an amazing talk on radiology. And actually, it's one of the most watched videos, actually, when you look back at the watchbacks in terms of the YouTube stuff. So it's really good, and it obviously hit the right mark. So really glad to get you on board. I want to try and cover quite a bit today. Some of the questions that I get asked quite a lot when it comes to radiology application. I know a little bit because MSRA obviously is part of application, and we do a lot of work on MSRA training, but there's some other bits that we don't know too much about. But I want to start just by getting you to set a bit of a scene, really, Shaitanju. I know you trained abroad, obviously, I think in Nepal, I think you said from your last conference. So let's get a bit of a brief journey, really, from the start of almost med school to where you are now as a radiology trainee. What are the steps that you had to jump through and some of the experiences that you had?
So yeah, as you mentioned, I did my med school in Nepal, and I finished my med school in 2018. And during the same time, during my internship year, which is the F51 equivalent year, I did my English exam, appeared for my PLABs soon after I finished my internship, and I came to UK for my PLAB 2 in 2018 itself. And I think I got my GMC registration around October 2018. And then I started applying for jobs, and I landed my first job in Blackburn, as a clinical fellow in medicine. And I joined NHS in January 2019. So I actually came with the intention of doing medicine initially, as I was always interested in medicine. But as I advise all my juniors, it's very, at this stage, like when you are just fresh out of med school, it's really hard to decide what you actually like or what you don't like, because you need to see it firsthand. When you actually work on the wards, when you work in maybe emergency, that's when you decide, like, do you actually like working here or not? So, so maybe 6 or 7 months into NHS, I just thought that I should probably explore some other specialties, and radiology was something which actually suited my interest. So I did a taste a week. After my taste a week, that's when I decided to apply for radiology. So in 2019, that was my first attempt at radiology. It was very half-hearted application, because I had just basically 1 month before the application, I decided, you know what, I'll just apply, but without any preparation, because I decided very late. So yeah, I did mess up my interview the first time.
Yeah.
And again next year in 2020, and that's when I actually applied with all my preparation, and I did get in my second attempt, and here I am. So currently I'm in Nottingham. I'm ST2 now, and I'm obviously it's radiology is 5 years, so I'll be staying in Nottingham for the next 4 years again. But yeah, that's been my journey. Hopefully, I do know that these days it's a bit difficult to get exam dates for PLABs, so your journey might be a bit more longer than mine, but don't lose hope. It's a long journey anyway. 1 or 2 years don't matter really. And once you reach here, you'll realize that it was all worth it.
Yeah, yeah. No, great point to kick off with, actually. And there's a couple of really interesting points that you said there. You initially were thinking about medicine, and then radiology came on the back of a taster week. So had radiology not crossed your mind? What did you do radiology back in med school? Was there a placement in radiology? Did you know much about it? Or was it only when you came here that you had that first thought that let's check it out?
The thing is, in med school, we're not really exposed to radiology a lot. I did have like a week of placement in radiology in my FY1 year. That's normal for everyone. That's how it normally works in India and Nepal. But obviously, it's a very limited exposure. You're not doing much during that rotation. So after med school, radiology is one of those specialties where you don't know much how it actually works in real life. So if you think that my interest actually started after I was, I just used to randomly open scans, like after reading reports. Okay, like I found something significant in the scan, and I was like, I'll have a look myself. And I just started building curiosity, and I just started liking this. So I did a taste a week, and that's when I actually enjoyed seeing the life of radiologist, and I was like, okay, this is something which I would like to do in future as well. So that's when my interest really began in radiology. Wow. And I getting away from medicine because, to be honest, it's a lot of medicine even in radiology because it's only up till the diagnosis part, and that's it. But still, it's a lot of medicine. So I think that kept my interest going on.
Yeah, it's really interesting that you hadn't really thought about radiology, and I think a lot of people who come from abroad, doctors who come from abroad, do come with an idea that I want to be an orthopedic surgeon or I want to be a hematologist, or whatever they have in their mind that they want to do, and very often you see that path change, don't you? It might be at the beginning, but sometimes people start training and then change, and it's perfectly okay for that to happen, isn't it? And to have changes in your mind, and as long as you end up in the thing that you think suits you best for whatever reason that may be, then you have a chance of doing the next 40 years. If you start in something that you thought you might enjoy but realize it's actually not for you, but still persist with it, sometimes it can lead to challenges, because life is challenging and things crop up that you're not expecting, and you need to at least be having something that you're happy at doing on a day-to-day basis. It's great that you found that, and you mentioned that you didn't get in first time around, and obviously a lot of people don't get into training first time around, and people perhaps from other parts of the world are not used to having rejection or not used to not getting things first time. So how did you deal with that? Did it hit you, or did you kind of take it as a challenge and move into the next one with a different mindset?
So I think, to be honest, I was not really expecting to get a training number in my first attempt because I hadn't prepared a lot, and obviously radiology is competitive. It's still very competitive. So I was not heartbroken. I was like, okay, I'm just going. At least I knew, because I reached the interview stage, so I knew the whole process, and I knew how to improve my portfolio score, my interview score the next time around. So yeah. I did work hard the next time, and I did make it. So, but I think that's something which a lot of IMGs, as you mentioned, that they're not used to taking that and accepting that, facing rejection. But I think once they start working in UK, they'll realize that it is very common to face rejections, and it doesn't really matter because you're still working, you have got a job in hand, and you're still living the life you wanted to. So I don't think so it really matters in the long run. And sometimes some people do get in the first attempt itself, but they might not get in a region of their choice, or because of family reason they can't move around. So I think it depends on a lot of personal circumstances as well. But I think you just need to keep going and just work harder. And each interview experience, it gives you some sort of experience to and take feedback from there and build on that. So that's what the IMGs who are here, they'll realize once they start working here.
Yeah, really good point. And we're going to talk about the application steps in a second and break it down for people who are wondering how to go through our radiology training. But I think that's a really, really important point. And it's not just getting into training, it stems from PLAB, doesn't it? People often fail PLAB, and that's the very first exam they've ever failed. And, it puts people sometimes back 2, 3, 4 years. And actually, it's just about, thinking that, you can learn from everything, and you can't be expected to get everything exactly as you want it. And like you said, sometimes people, when they do applications, not just for radiology, but for other specialties as well, they may not do as well as they hoped, and they may get an offer, but it may be in a place that they never would have dreamed of going to. It may be in a part of the country where they've got no links, no connections, nothing really going for them, but they take it because they feel that, well, I can't let a year go, for example. I can't waste a year. I can't let things build up, and then you end up making those wrong decisions. So sometimes, even if you get an offer, it's not perfect for you, and there's nothing wrong in saying, you know what, this isn't quite right. My gut feeling is not telling me that this is where I need to go. Let's take a year out, do something else. Because like you said, you're still employable. There's still plenty of other work going around, and actually sometimes when you get in second or third time, you look back in 10 years and think, I'm really glad that happened, because it changed me. It made me learn in a better way. I learned more things, whatever it may be. So really important points. And, for somebody who's worried about not getting in first time, take inspiration from this story, because it clearly shows that there's still plenty of opportunities ahead, and you can still make an amazing career for yourself. But let's talk about application then, because this is what people, application time's coming around again, and things change from year to year. So let's kind of try and briefly, if you can, Judhanshu, break down the steps that people need to think about if they're going through radio. Let's say they've passed PLAB 1, let's say they've passed PLAB 2, let's say they've got GNC registration. What are the kind of things will be coming up for them?
So yeah, so as you mentioned, the applications are going to open soon. So usually it's the first week of November when the adverts come out for most specialties. So radiology is no different. It will be probably around first week of November. And I think by mid-November, you should be able to start applying. So for most of the specialties, the applications open on a website called as Oriel. So if the IMGs were not familiar with that, it's a separate website from the non-training jobs. So you apply for all the specialties on Oriel. You have to apply, if you're applying for multiple specialties, you have to apply to each specialty and you have to fill a new application form. So let's say, let's focus on radiology. So you fill your application form on Oriel, and I think they close the adverts. They close the application by first week of December. So for IMGs, because obviously you've not done your F1 or F2 here, there's one very important thing you need to have, and that is to get your CREST form signed. You can find more details if you just Google CREST form GMC, and you can actually go through that form. It hasn't been updated in the last 2 years, so we are still using the 2021 CREST form. But just to give you a brief idea, CREST form is something which proves that you are as competent as a F2 doctor in UK. So that is required before you apply to any specialty. And it can be signed by any consultant under whom you've worked for at least 3 months. So if you're working in a non-training job in the UK, most consultants should be happy to sign it off if you worked for at least 5 or 6 months. Obviously, it depends. Some consultants, they can be strict, some are more lenient, but usually they should be happy in 5 or 6 months, as long as you are able to prove all the competencies listed in that form. So that's your first step, getting your CREST form signed. They usually give you a deadline before, so as I said, the applications will close in December, the first week of December, but they do give you an extended deadline to upload your CREST form. So even if you're late in getting that CREST form signed off, you can still request them for additional time, and they might give you that. So that's the first thing. Once the applications close, now because of COVID, we have had virtual interviews and virtual portfolio portal. So you don't actually need to take your portfolio folder to the interview, because there is no face-to-face interview. So once the applications close, they will give you a link to upload all your portfolio credentials. And that's it's a portal which is used by many other specialties again. So you will be asked to upload your portfolio. Again, that is something which will happen in December, and it will close in December. So if you're planning to apply for radiology beginning next year, you need to have your portfolio ready by December. So make sure you've got everything, which I will tell you in a while. But make sure you've got your portfolio sorted by December. Now, the next step, which is actually the first step, would be the MSRA exam. So that's the biggest thing in your journey to radiology. So once you're done, once you've made your application, once you've uploaded your portfolio, you will get an email from the specialty, and you will be asked to book your MSRA exam. And we haven't had any news about the MSRA dates yet, but usually I think it's held in mid-January. And
it's 5th. Yeah, I think it came out. It's 5th to 17th. Okay. 5 to 17 of Jan 23 is this year's MSRA.
Yeah. So those will be the dates, and you will have an option to choose between any of those dates. It's a free exam. You don't need to pay for it, and you can take it anywhere in the UK or even outside UK. There are centers. I think there are some centers in India as well. So that's your first step. Once you're done with your MSRA, they will, the MSRA, the point of MSRA is basically to screen candidates to invite them to interview. So what will happen is, what happened during my time was they invited the top 600 people to the interview. So usually the number is decided by the number of posts. So let's say if there are 300 posts for next year, they will invite double the number. So they will invite top 600 people from MSRA. If it's 400, they will invite 800 people. So they invite the top 600 people to the interview. And obviously, once you reach the interview stage, it's a 1 in 2 chance that you will make it to radiology, because you've got 300 posts, and then, of course, there are 600 candidates. So that's the brief timeline. The interviews will happen in March, and between Feb and March. Sometimes it's in February, sometimes it could be late. It could be in first week of March. But the offers are generally released by the end of March. And this year, I think they're saying by 30th of March, they will start releasing the offers. So this is the brief timeline of what is going to happen. So again, to summarize, you've got your applications in November. You need to upload your portfolio by December. You'll be taking the MSRA exam in January, interviews by February or March, and you will get your offers from March end, and it will go on until all the posts are filled. So this is a brief timeline.
Yeah, perfect. To the point and crisp, and you know, a lot of specialties now are starting to open up. So when you apply for radiology, like Sudhanshu mentioned, you can apply for multiple specialties. So you don't need to say, right, I only want to apply for radiology. This is my final decision for life. You can apply for GP, radiology, etc., etc., and it's all through the same oral system that Sudhanshu mentioned. There's some really key points about the CREST form. We get a lot of queries about CREST, and as Sudhanshu said, the latest CREST form is 2021. So don't be put off by the fact that you don't see 2022 or 2023. A lot of people kind of feel they're doing an outdated form. There hasn't been one. In the one before the 2021 was around for a number of years. So they don't really update these very often. So if you're wondering about that, then it is the 2021 form still. There hasn't been a new one released, but of course things can change. But by this stage, I don't think they're going to release it for this application, isn't it? And the MSRA exam, like you mentioned, is the same exam that you take for multiple different specialties. Yes, you take it if you're applying for radiology, but you also take it if you're doing GP, psychiatry, ophthalmology. Now, surgery has started, of course, this year. It's brand new to CST now. And it's the same exam. So you don't have to sit different exams for different specialties if you apply for multiple ones. It's the same one. But it is a ranking score, isn't it? It's not a pass or fail exam. It's a ranking. So you've got to kind of say, look, I've got to fight for every score, because that either gets you into a specialty like GP, or for radiology, like Sudhanshu says, it gets you into that top cohort that then takes you into the next stage. And actually, I didn't realize it's a 1 in 2 chance then, isn't it? Which is quite good to look at it that way. That if I get through this hurdle, then I've got a 1 in 2 chance, and you're almost there really, if you see it in that aspect. But if you do want help on MSRA, then we do a lot of courses and resources for MSRA. So have a look at the website, auroramedicaleducation.co.uk. We've got lots of stuff for MSRA, because it is a competitive exam, and the better you do, obviously, the better the chance you get into those final stages. So that was great. And your own interview, how did that go when you did it back in your time, Sudhanshu? How was your interview? Was it a single one? Was it a multiple? What was the format?
So when I appeared for the first time, it was a face-to-face interview. That was pre-COVID. And so the interviews were only held in London, and we had 2 stations: the actual interview and the portfolio station, where I actually had to take my physical portfolio folder. But anyway, it doesn't matter, because it's still going to be virtual again this year. So the virtual interview is a really short one, because I think it will last about 10 to 15 minutes, and they will only ask you 4 or 5 questions. So you'll have two people taking your interview, and each of them, they will be given 2 or 3 questions, and it won't last long. My interview lasted about 12 minutes, and it's a very generic interview. So I did see a difference in my first interview, which I gave in London, and the one which I actually gave last year, sorry. And the difference was, the first interview was more radiology specific. There were more radiology specific questions. Now, radiology specific doesn't mean they're going to give you an X-ray or CT to report. It's just more related to radiology. Like, do you understand radiology? The virtual interview, it was a bit generic. Like many other specialties, it did not really feel like a radiology interview. It was more like they asked me ethical scenarios, and they gave me some scenarios ward, and how would you manage that. And it was more like a informal chat, really. They did ask me, like, how do you deal with stress? So it was a very generic and vague interview, and it did not really feel like a radiology interview. But I think they were testing more of your communication. But the important thing is, when you're going to a radiology interview, many people actually think that they will be given a scan to report. They will be asked questions about actual radiology, but that's not true. It doesn't matter. They don't know how much experience you've got. They don't even know whether you've got any kind of radiology experience, or whether you've done radiology back home. They don't know any about of that thing. So it will be very generic for everyone. They're not going to ask you anything about radiations or anything like that. So I think for the interview itself, I think there are some general books which are available everywhere, but because, as I said, they did ask about ethical scenarios, and I think you yourself during your course for SJT for the MSRA part, you do explain how things work here. So I think that would be really useful if people, if you do watch Dr. Arora's videos, they will be helpful in the interview as well, because there will be ethical scenarios, and you will be asked to explain what you will do. So it was, yeah, as I said, it was a very generic interview, really.
I think that's a really important point, Shitanshu, that, you know, they're not, then when you go for these application interviews, it's not just radiology for any, they're not looking for the end point. They're not looking for a radiologist. They're looking for two things, I guess. They're looking for, number one, is this person trainable? Like if this person starts training, do they seem like they have the competencies that they will end training if we help them along the way? And number two, have you got a passion for what you're applying for? Or are you just applying for it because you think it's a nice job, or you just like the idea of it, or you didn't know what to do and therefore you applied for it? And as long as you've got those two things, you can show that, you know, at this stage of my career, I've got all the competencies that I need to be trained for this. And number two, I have some kind of passion or want, or I've looked into it a little bit to understand a bit about what I'm going for. And if you can demonstrate those two things, then, and even if you don't know how to report an X-ray at this point, it doesn't make a difference. You're trainable to do that, and you've got the basic building blocks. So that's a really, really important point, not just for radiology interviews, but for other ones as well. You know, they're not looking for the end point.
I want to add here. The thing is, the people who are taking your interview, they have not seen your portfolio. Okay, they don't know anything about your portfolio score, what you have done related to radiology. So that is something you should try and indirectly add during your interview. You might not be given an option, but from the feedback I've received from my own interview, they do ask you in the end if you want to add anything else. So that is your point. That is your moment. You need to tell them what you have done related to radiology. If you've done audits, talk about that. If you've attended any conferences, if you've won any poster prizes, tell them about it. Because unless you tell them, they don't know what you have actually done. And that actually shows passion. So as Dr. Arora mentioned, you need to show that you have the passion for radiology. And yes, the second thing is the person who's taking your interview, they are thinking in their mind, would I want this person as my trainee? So that's very important. You need to sell yourself. So whenever you get the opportunity during your interview, do talk about your portfolio, because they don't know about that.
Yeah. And another really, really important point, as medics, generally, we are terrible at selling ourselves. Like, we kind of feel like I can't say this, or it seems too big-headed, or I don't want to say too much that it looks like I'm saying X. Forget all of that. This is your chance to shine. If they don't know what you have in here, in your background, in your mind, then no one can assume anything. They can't assume that, oh, this person must have done all of this stuff, or that this person must have been to this, done some work experience here, or taster weeks here, or done this audit, or they just can't assume that. So the next person you've got to expect that is going to be selling themselves. So if you don't get to that idea of, I'm able to sell myself in a humble way, but showing that, you know what, this is why you really need me to be in this training program. You know, I can bring X, Y, Z to the table. Unless you do that, you know, and you just seem like a nice doctor who answers the questions perfectly well, it may not give you that edge. So sometimes as medics in general, we're just not very good at selling ourselves. And that's something that you really need to put across. That's an amazingly well put point, I think. There's a quick question coming to answer about the CREST form. Can it be signed from consultants back home?
Yes, it can be. The only thing is, if you end up working for 3 months in the NHS, then your previous CREST form from back home becomes invalid. Then you need a new CREST form signed by a UK consultant.
Yeah. So if you're going to do it, you need to have it all planned out in a very quick period of time, isn't it? Yeah, absolutely. And as you said, if you work with somebody for 3 to 4 months, you know, in the NHS, in a general job, you know, as long as it's not a tertiary centre where you're doing a very specific role, you have all the opportunity to demonstrate those competencies in the jobs you do, because they're pretty generic, aren't they? They're pretty kind of straightforward things that you're not going to be doing at the latter part of your career. There's stuff you're going to be doing at the beginning part of your career. So that shouldn't be a problem. If people are worried about CREST form and the competencies, you know, even if you are doing it in the NHS and it's your first job, you know, please don't be worried. It's designed for you to just demonstrate those basic core things that allow you to then apply. And this is not part of the application as such to see whether you can be radiology trainee. This is just, have you got the core basic building blocks for which to build on. So really, really important point. Now, you mentioned the taster week that you did. Tell me 3 things that you think sell radiology? Like if someone is thinking, yeah, I thought about it, I'm not sure, don't know enough about it, what are three massive pluses that you think a career in radiology will give XYZ who's thinking about it?
So I think the first thing would be the variety of work they do, because obviously I was working on a medicine ward, and I went to radiology to do my taste a week. So each day, and actually in fact each session was different. So for example, on a Monday I was doing CT reporting in the morning, then I was in ultrasound list in the afternoon, then the next day I'm doing fluoroscopy, IR. On the third day, I'm doing nuclear medicine. On the fourth day, I'm doing some MSK stuff. So the variety of the kind of variety you get in radiology, it just it doesn't make your life monotonous. You could end up like I did have a monotonous life in medicine, especially while I was working on some wards, because every day my basic job on a ward was to order investigations, make some small changes to the management, do discharge summaries. So all of that seemed a bit monotonous. But yeah, in radiology, it's the variety of work is really good. So, and the thing is, even when you specialize during your training, even after you become a consultant, you still have the option to just keep learning new things and just add it to your own CV. So that's one thing I would say. The second thing, of course, the work-life balance. Obviously, I'm a trainee, so I'm not working from home yet. But yeah, I do see my consultants. Many of them, they work from home, and especially on calls. When I'm on call in the hospital, I would be expected to be in the hospital, because I'll be the first port of contact for a clinician. But the consultant is obviously at home, so they're reporting from home. So I think that is a really that gives you a lot of satisfaction, because I would personally prefer to work from home myself rather than 1 hour away to work and come back again, getting stuck in the traffic, look for parking. So that is another selling point. And the third point, I would say, it's a very demanding specialty. Obviously, now people do say that sometimes I get asked this a lot, that okay, I'm planning for radiology, but other clinicians say that radiologists will be replaced by machines and whatnot. So that is something, obviously, a challenge to radiology. But I actually tell them clinicians will tell you that, because they don't know what actually happens in the radiology department. There are so many things. You're only talking about one thing, which is CT reporting, which might be at some point in the future, 100 years from now, get taken over machines. But there's so much else we do. It's a very demanding specialty. And instead of some AI taking over radiologists have actually started taking over many other clinicians' work. Like, for example, the IR guys, they're doing so much of surgery work now. And they're just trying to expand their hands in everything. So it's a very demanding specialty, and it's growing. It's a growing specialty. So as I said, you will never be out of work. And the other thing is you can work from anywhere. So I think these three things were really a selling point to me, and it really suited my own lifestyle. So I was really impressed by what they were doing. And thankfully now I'm in the specialty.
Yeah. No, excellent. Three really, really important points. The variety is obviously a big thing, and there's only very few specialties in the UK that will give you variety across the board. General practice obviously is going to be a big variety there. Acute medicine can give you variety. A&E can give you variety to some extent. Radiology, like you mentioned, pediatrics, I guess, although it's variety within a smaller framework. But yeah, really, really good points there. And like you said, radiology is not going anywhere, is it? Every specialty is going to be there forever. It's just they're going to adapt. And if you're happy to go into a fast-changing, dynamic specialty, and I can't think of one more than something like radiology, just because of the amount of tech that's coming in to healthcare. Radiology is right on the forefront of that, isn't it? Because it started with the tech, like it had the tech at the beginning, and now it's just taken it to the next level. So yeah, some really, really good points. But let's try and flip it around, and if you had to be double active, what would you think about maybe 2 or 3 negatives of radiology that perhaps radiology is not going to be for everybody? So what are the few things that perhaps you might have seen a few colleagues start radiology and then maybe come out or leave? Is there any reasons that you can see highlighted?
So I think the biggest reason, so I do have, I do know, not personally, but I have heard of trainees dropping out of radiology in my own deanery. It does happen, very rarely, but it does happen. And I think the biggest driving factor is the lack of patient contact. Like, some people, they actually miss the patient contact, because to be honest, the only time I'm with a patient is either if I'm doing an ultrasound list or if I'm doing some IR work. Otherwise, it's always in my own small room. I'm just reporting from my computer. Most of my work is based on a computer. So some people actually miss the patient contact. That's why it's really, really important you do a taste a week, because it is an attractive specialty, but you do need to actually go in the department and see if you would like it or not.
Yeah.
And obviously, I talk to my friends, like some of them, they're surgeons, some of them, they're still medics, and they just say, no, we can't do radiology because no, we cannot live without seeing patients or actually talking to patients. So yes, it does happen. And along the same lines, I would say the second reason is sometimes it can get a bit lonely when you are in radiology. So for example, especially during training, at the moment, like I'm based in a DGH hospital, I'm outside Nottingham. So when I'm on call, I'm alone. During most of my week, I am alone. Like, it's really hard to find anyone else. So it's just basically me going there, doing my work and coming back home. So yes, it does feel lonely sometimes. Obviously, if you're working in a ward or if you are in a GP practice, you have a whole team, you have people, you chat, you have some social life even at your workplace. But yes, that is one drawback in radiology.
Yeah, really, really important. And again, for anybody who's thinking about radiology, knowing both sides is very important, because that's when you can make those kind of decisions that is it right for me or not. And the patient contact thing is an important one. And it may not be such that there's lack of patient contact, because you can do parts of radiology, like you mentioned, where you're seeing patients quite regularly, but it's sometimes the evolution of the patient journey that people miss, isn't it? It's the fact that you see them at the beginning, you've got the puzzles to think about, you've got to think about, here's a diagnosis, now let's think about what's the next step, how do I manage it medically, non-medically. And so it's that evolution of the journey that you miss maybe in radiology, or because you can have patient contact, can't you? You can see lots of patients and engage with them, but maybe it's that's also something that people may miss, because part of your brain as a clinician is that journey sometimes, isn't it? And the things to think about. But that's really helpful. Now, you mentioned very quickly, for those of you who don't know much about the program, 5 years you said, and how is that split in terms of the exams that you have to take, and also when you think about the specialty side of radiology itself, what's that pathway like?
So if you're just it's 5 years if you're not doing IR. If you take up IR as a subspecialty, it's going to be 6 years. But otherwise, it's ST1 to ST5. So ST1 to ST3 is more like general radiology. You are expected to rotate in different subspecialties. But so ST1 is very academic. ST1 you are because obviously radiology is something we have not done much in our med school. It's a completely new specialty, so you actually need to learn a lot of things in a very short frame of time. Like, you need to learn the radiological anatomy, you need to learn the physics part of radiology. So during ST1 you are expected to pass your FRCR Part 1 exam, which tests physics and anatomy. And once you're out of ST1, from ST2, you will start working more independently. So independently, as in you'll be doing your own ultrasound list, own fluoroscopy list. You'll be releasing the provisional reports for CT scans and some MR spine. So you'll become a lot more independent from ST2. But as I said, that jump from ST1 to ST2 is a big jump, because you're entering a very new specialty, and within 1 year, you are expected to learn a lot of things. So you go from knowing nothing about reporting to actually releasing your own reports in just 1 year. Plus, you need to pass a very difficult exam. So that's your ST1. From ST2 to ST3, you will be rotating in blocks. So you will be doing like MSK block for 3 months, then neuro block for 3 months. So that's how you get time to decide what you want to specialize later on. And from ST4, you need to decide your subspecialty. It could be neuro, MSK, IR, etc., etc. If you're choosing IR, it's going to be ST3 to ST6. ST4 to ST6. But yeah, in ST3, you need to decide your subspecialty. So if you take, for example, neuro, you'll be doing only neuro for ST4 and ST5. That will be your normal day work. But when you're on call as a trainee, you will obviously be reporting everything. So at the end of the day, you will be a general radiologist when you get your CCT, but with a subspecialization in one of the subspecialties. So there is no subspecialty like general radiology. You have to definitely choose one subspec. So that's how it works from ST1 to ST5 and ST6 if you're doing IR.
Yeah, that's a really helpful breakdown. And just so people are clear, when you get to the end of ST5, if you've completed every step, you are a consultant radiologist that is able to work in the NHS. You can start applying for consultant roles, and the whole future of your career begins at that point, isn't it? So, and there's no more exams once you're done. Once you come out at ST5, you've completed, you're done.
Yeah.
Yeah,
And
yeah.
I forgot to mention about the part 2 and the last 2 exams. So part 1 during ST1, and the second part is part 2A. You can give it after you've done 24 months in radiology, so you can do it in your 3rd year. And part 2B, which is the final exam, it's an OSCE exam. You're expected to pass it during your ST4 year. So you've got 3 exams. They are difficult exams, just like any membership exam. All of them are difficult. So radiology is no different. The difference is obviously, if you're taking some other exam, at least you have some background. Let's say if you're giving MRCP, you have some background in medicine, but radiology is completely different. You have really no background to radiology from your med school days. So they are quite difficult exams, but most of my senior trainees whom I've known, they do take several attempts, but ultimately everyone manages to pass it. Most of the people manage to pass it. But yeah, once you're done with this, once you're a consultant, once you're done with your 3 exams, there are no more exams to give.
Fantastic. Fantastic. Yeah, that's brilliant. I think that's, a lot of the common queries that we get, I think we've managed to squeeze in to around 30, 40 minutes, which is great. I think there's a lot of value that I hope people have got from this. We're going to be putting this back on our YouTube channel, so you can watch it back at any point if you want to go back and rewatch some of the bits that Shantanu was saying, because there's a lot of stuff is packed into that, and I think it's hopefully going to help a lot of people. So Shantanu, thanks so much. Finally, is everything going to plan in terms of the decisions that you've made so far? Coming to the UK, moving from one country to another, choosing radiology, being in Nottingham. Is everything panned out as you'd like? Just give a bit of a flavour about some of the challenges that people often get in the journeys from abroad to the UK and the NHS.
I think the biggest challenge which a lot of IMGs are facing at the moment, and they are quite hesitant about moving to UK, is obviously what we see in the news. Like, yes, there are problems within the NHS. We are short-staffed. There's underfunding. The cost of living has gone high in UK. The salaries might not be as great as other countries. So yeah, there are a lot of challenges, and many IMGs, obviously, I do get messages every day. I see these messages in the groups, Facebook groups, that people are not happy. But the thing is, the first thing you need to realize is that you do not, if you're planning to move to UK, you cannot move with the expectation of achieving everything you have planned for, because plans do not actually work out in our favor always. So that's the first thing you need to realize, that if you're moving to UK, don't come here with the expectation that you're going to achieve everything just because we heard that, okay, it might be easier than India. Obviously, India has a huge population, the competition is higher. But doesn't mean that even though competition might be less than India, but it doesn't mean you're absolutely guaranteed of getting a training. That is first thing. But if I talk about myself, then yes, as you mentioned, because I came to UK, my UK journey was just 1 year. Within 1 year, I was done with my PLABs. I managed to get a good job. And in my second attempt itself, I managed to get into a competitive specialty. And I'm actually enjoying that specialty. I actually like going to work now. It's not like, I'm regretting my choices. So for me, if I talk about myself, it's worked out pretty well. And I think in my free time, I do like to help IMGs, and that's what I've been doing for the last 1 or 2 years. So everything's been going great for me. So if I feel pretty happy in UK. Of course, there are problems. There are going to be problems in every country you go. No system is flawless. So you just have to accept those flaws, and just try and find a solution for that. And I'm sure it will all work out well. But yeah, it is very important to realize that you should be ready to face challenges. People face challenges at every step. Some people, they're not even able to get a PLAB date. Some of them, they're struggling with maybe one or two both the parts of the exam. So it is a big journey. It is a long journey. You just have to be really patient, and you need to accept the fact that it might take several years before you actually realize all your dreams. So if you are patient, if you're up for that, definitely this is a good path for you.
Yeah, amazing. And it's not by chance that everything happened so well for you, Shantanu. It's not that you were just lucky and you got through PLABs quickly and you did your radiology, you got into the specialty. You worked hard for it. You were clearly organized. You clearly had, you researched things. You put the work in to allow you to have it so smooth, I would say. So as long as people do that, as long as they've researched what they're doing, as long as they understand the exams they're preparing for, as long as they talk to people who have done it, as long as they, are smart about the way they go about things, then no specialty is too competitive. No route should be closed to you. And you can take up any position that you wanted to in the UK. So hopefully it's given people a bit of some motivation. And Shubhanshu, if people haven't found you before already and they're finding you for the first time here, firstly, please do follow Shubhanshu here. He does some amazing stuff on Instagram itself. But where else can they find you? Which other streams are you on? Where else do you help these IMT ducks?
So at the moment, it's just on Instagram mostly, because I think most of my followers are on Instagram. So I usually organize everything via Instagram. So if I do anything, I just update it on my stories.
Brilliant. Brilliant. Yeah, there really, really is some amazing stuff. So please, guys, do follow if you're not already. If you're new to us at this, then please do have a look at the kind of things we do. We try and help doctors, international doctors, through many different exams, from PLAB 1 through to PLAB 2 to MSRA to MRCGP, and try and help you not just pass exams, because that's part and parcel of life, but trying to get you to reach your potential and maximize your potential, because there is so much potential out there. And I do feel that people don't often get to that point where they're demonstrating just how much they can offer to the UK NHS. So if you do like what we do, please do have a look at some of our other channels: YouTube, Instagram, Facebook, TikTok, LinkedIn. We pretty much do anything out there, and hopefully we can help you in exams such as the MSRA, like Shubhanshu was talking about a little bit earlier on. And hopefully we'll be getting together again and doing some stuff on general practice on Instagram in the next couple of weeks. I hope to see some of you guys there. But Shubhanshu, any kind of final points that you want to make before we close this down? I think you've added so much value already, but any kind of last few things to say to the guys who are watching?
Yeah, so again, thanks again for doing this. I guess I already talked too much about radiology, but yeah, for the people who are like my followers, who have not checked Dr. Arora's website, because he does a lot of courses for PLAB 1 until MSRA. So you've got PLAB 1, PLAB 2, MSRA. And in fact, if you actually look at the YouTube videos, I'll give you my own personal example. I did not know a lot about Dr. Arora while I was doing my PLAB 2, but during my time in PLAB 2, I actually used to make my own management plans by looking at his videos on YouTube, because I think you make like short videos about the patient management, and you've got some good videos about tackling difficult patients. So do watch his YouTube channel. It's a really good content for PLAB 1 and PLAB 2. And obviously check out his website. It's really useful for people who are planning to take MSRA or even PLABs.
Awesome. That's really, really kind, Shubhanshu. And I'm glad that you could use some of our stuff back in the day when you're doing your PLAB 2 as well. But yeah, thanks so much. What your plans for the rest of the day? Anything good?
Yeah, I think I'm on call tomorrow. So,
okay. So today's just a chill out evening then?
Yeah.
Yeah, fantastic. But listen, thank you so much once again. Really appreciate the time that you've given everybody today. There have been a couple of questions. I'm really sorry I haven't been able to get through every single question that's come through, but I've tried to answer as many as we can as we go through the live today. But yeah, thanks so much, Shubhanshu. We'll catch up again very soon. Have a great evening.
All right. Bye.
Take care. Bye. Bye.